Ted Cruz speaking on the health care bill. Let's listen.
The ideological differences among the conference, and we've been working collaboratively that entire time trying to solve the problems, the underlying problems in health care. This current draft doesn't get the job done. But I believe we can get to yes. I believe we can get this done. There is an agreement to be reached. And I have been, for the last 5 months, working around the clock to get to that agreement. And I still believe we can get there. The key to getting an agreement, to getting a bill that can pass, is we need common sense reforms in the bill that lower the cost of premiums. The single biggest reason that so many people are unhappy with Obamacare, that are hurting under Obamacare, is because it's caused premiums to skyrocket. When I'm home in Texas, I hear over and over again from Texans who say, I can't afford health insurance because of Obamacare. We've got to fix that. The current draft circulated this morning doesn't do nearly enough to lower the cost of premiums, but there are a number of common sense reforms that have wide agreement with the Republican conference that we can include, and I think we should include.
Can you talk about the amendments that you're going to offer?
Well, one of the suggestions that I put forth is what I call the Consumer Freedom Agreement, that says that if an insurance company is offering a health insurance plan in a state that is consistent with the Title I mandates, that insurance company can also sell in that state any other plan that consumers desire. What that would have the effect of doing is immediately dropping the cost of premiums. You know, when we met with leaders of insurance companies and we asked, as I've asked them repeatedly, what is the most important piece for lowering premiums? The answer that we consistently hear is, let us sell the policies consumers want to buy. What that would enable people to do is buy low-cost catastrophic policies and enable people who don't have insurance right now because they can't afford it to be able to afford insurance. And it doesn't take anything away from anyone. Instead, it adds additional choices, more competition, more options, lower prices. That's what consumers want, and it's what the Republican majority should give to them.
Senator, earlier on you said it was important that these things not be negotiated in the media. Why are you coming forward publicly with your complaints about the bill now?
Well, look, this has been an ongoing process. We have had a long, deliberative process. Early on, the working group met for over a month with no leaks to the media. We met right next door, right in that conference room in my office, working to come together. We've made a lot of progress. There's a lot of agreement. Not all of that agreement is reflected in the current draft. We're at a different stage. There's now a bill draft that is public, and so there has been a lot of public debate on Obamacare for the last 7 years, and there will continue to be debate. We can get this done. We can get to yes, but the key to getting it done, to getting to yes, is we need common sense reforms that lower the cost of premiums so that health insurance is more affordable for families who are struggling.
Senator Cruz, are you making yourself, people sometimes when we get to these big bills, they put themselves in play. It doesn't do this provision or whatever, and then you can trade horses and maybe get those things, and it's good optics. I fought for this, look what I got. Is none of that going on here? These are just things that you oppose, or do you think that by saying no, that they will come to you and say, maybe we can help you on this issue, maybe help you on this issue, and maybe get you to yes?
You know, I have been clear from day one that I want to get to yes. When I ran for Senate, I campaigned on repealing Obamacare. It was the central promise of the campaign. In my time in the Senate, nobody has fought harder against Obamacare than I have. This matters. We've got to do it, but we've also got to get it right. It's not enough just to pass a bill that has Obamacare repeal in the title. We've got to actually have legislation that fixes the underlying problem. You know, under Obamacare, the average family's premiums have risen over $5,000 a year. That is the fault of the federal government. It's the fault of the failed federal policy that is Obamacare. We need to fix that. And so throughout the conversations with the working group, with the majority leader, with the president, with the vice president, I've made very clear I want to get to yes. And the way to get to yes is fix the underlying problems, lower premiums, and I will happily be part of it. We can get there, and I think there are a lot of other senators who feel very much the same as I do.
What about resolving that in a conference committee, and you turn out to be the person that prevents it? You're the 49th or 48th vote, and they're just shy.
Well, I think we can get there, but this current draft doesn't do nearly enough. This current draft, my biggest concern is under this current draft, premiums would continue to rise. And if premiums continue to rise after we hold a press conference claiming to have repealed Obamacare, that's a disaster. It's a disaster politically. It's a disaster substantively. It would be a failure of the mandate we've been given by the voters.
Would you be willing to make changes on the Medicaid legislation as it currently stands? Because even if you guys turn to yes, there's still the potential that the moderates like Lisa Murkowski, Susan Collins could be no's to support this.
Everyone expects this current draft for there to be significant changes to it. And indeed, the majority leader and the staff in rolling it out, they said this is a discussion draft. This is a first draft. There are going to be significant changes. Of course, we're going to have to continue having a negotiation. Everyone's going to have to give. That's the only way you can get at least 50 out of 52 Republicans. We have a very narrow majority. The only way you can get to yes is if everyone is willing to give some. And I think the keys to it are focusing on issues, on principles that bring us together. And two principles that bring us together that I think are the keys to getting agreement and getting the job accomplished are, number one, lowering premiums. If premiums go down, that's a win for everyone. It's a win for conservatives. It's a win for moderates. It's a win for the men and women we represent. But number two, another principle that unifies everyone is state flexibility. Letting states have far more flexibility. So, for example, with Medicaid, letting each individual state design creative and innovative new plans to care for the most vulnerable. Letting a more moderate governor like a John Kasich in Ohio do what the state of Ohio wants, and letting a more conservative governor like a Greg Abbott in Texas do what the state of Texas does. The beauty of a principle like more state flexibility is that it unifies our conference. It gives a win for everyone. And if we come out of this with premiums going down, with consumers having more choices, more options, lower prices, and states having more flexibility for creative, innovative solutions to caring for the most vulnerable, that is a big win.
But on Medicaid, though, you'd be willing to make changes.
You're watching Senator Ted Cruz live speaking to reporters about why he can't support this GOP draft health care bill.